Good morning, everyone. The topic for today's class is psychosis versus neurosis, schizophrenia and classification of psychiatric disorders. I am Dr. Riya Gupta, Junior Resident, Department of Psychiatry. Okay, so let's start neurosis. अब neurosis क्या है? It is a mental condition which is characterized by excessive anxiety, emotional instability, or distress without a loss of reality perception. Individuals with neurosis are aware of their difficulties but struggle to control their emotions and reactions. As in इंसान को पता है कि कोई दिक्कत है बट वो अपने इमोशनल आउटबर्स्ट को कंट्रोल नहीं कर पा रहा है. इसके जो बेसिक की फीचर्स हैं वो है persistent anxiety, वरी या डिस्ट्रेस. इसमें कोई भी hallucination या delusion नहीं होता. Hallucination या delusion क्या होता है that will be explained to you in the further slides. They're aware that their thoughts or behaviors are irrational but unable to stop them. It is often linked to stress, trauma, or maladaptive coping mechanisms. What are the common type of neurotic disorders? This spectrum of diseases include anxiety disorders, which is GAD, generalized anxiety disorders, panic disorder, phobia, OCD, that is obsessive compulsive disorder, depressive disorders, dysthymia, which is persistent depressive disorder, adjustment disorder and depressed mood, somatic symptom disorders, PTSD or post-traumatic stress disorder. ठीक है, causes क्या होते हैं? Firstly, it can be genetic. For example, someone having a family history of depression, someone having a family history of anxiety. Like some individuals may be biologically prone to anxiety or emotional dysregulation. Then we have other factors जैसे early life experiences हो गए, childhood trauma हो गया, neglect या unstable family environments हो गए, personality traits, perfectionism, जो ज्यादा वरी करते हैं, जिनकी ऑलरेडी सेल्फ कॉन्फिडेंस बहुत कम होता है, वो बहुत ज्यादा प्रोन होते हैं न्यूरोटिक डिसऑर्डर्स डेवलप करने के लिए. हमारे एनवायरमेंटल स्ट्रेसेस हो जाते हैं जैसे मेजर लाइफ इवेंट्स, मेजर लाइफ चेंजेस, लूजिंग अ पेरेंट, कोई अनरिजॉल्व्ड कॉन्फ्लिक्ट्स हो गया, क्रॉनिक स्ट्रेस हो गया, कोई डेबिलिटेटिंग डिजीजेस हो गई. All of them come under environmental stressors. Now coming to the treatment. The first and the foremost important treatment is your CBT, which includes cognitive behavioral therapy. It helps modify dysfunctional thoughts and behavior. Basically, cognitive behavioral therapy helps you to recognize your stressor. How do you react to it? Is it a good coping mechanism? Is it a bad coping mechanism? How can you change your thought process and make your thoughts less distressing to you and help you cope up with all the stresses in your life? Because eventually life में stress is not going to reduce. It is you as a person who has to adapt with the stress. We have medications like antidepressants. The class of medication for antidepressants usually preferred for long term, and the first drug of choice for any neurotic disorder is SSRIs and SNRIs, along with anxiolytics. Anxiolytics हमारे होते हैं benzodiazepine जैसे clonazepam, alprazolam, lorazepam. ये सब हमारे short term management के लिए symptomatic relief के लिए हम लोग देते हैं. Lifestyle changes हो गया जैसे stress management, exercises, medication, yoga, and all your social support comes under lifestyle changes. This is your domain where you guys work. Coming to psychosis. So psychosis, it's a severe mental condition in which a person lose touch with the reality. They experience delusion, hallucination, and disorganized thinking. It can be a symptom of various other psychiatric and medical conditions rather than a standalone disorder. So what are the key features for psychosis? They include loss of contact with reality. There is hallucination, that is seeing, hearing, or feeling things that are not present there. Then you have delusion. What is delusion? It is a strongly held false belief. False as in it is not true at all. It is often paranoid or grandiose. I will explain delusions further, more with further elaboration in the upcoming slides. We have disorganized thinking or speech. That is the speech form is disturbed. There is jumping between topics. There is incoherence that you're not able to understand what the patient is trying to say. And word salad, wherein there is no meaning of what they are saying. It's like the words are jumbled up and making it a salad. Coming to impaired daily functioning, there is basically difficulty maintaining relationships with work or self care. Causes of psychosis, again, what are the primary psychiatric disorders? We have schizophrenia. Schizophrenia, it is a chronic disorder with persistent psychotic symptoms. We have schizoaffective disorder. Schizophrenia symptoms, when combined with mood disorders or affective disorders, we call it as schizoaffective. We have bipolar disorders with psychotic features, which includes psychosis that occurs during severe mania or depression, major depressive disorders with psychotic features, substance-induced psychosis. Usually, it happens with psychoactive substances, say drugs like amphetamines, LSD, or party drugs, cannabis, alcohol withdrawals. All of this can trigger psychosis. Psychosis is even present in medical conditions such as brain tumors, epilepsy, dementias, yeah, infections affecting the brain. Psychosis can also be present in acute stress, yeah, trauma, like severe emotional trauma, sleep deprivation, and all of this can cause something called as ATPD or brief psychotic episodes. Now, types of psychotic symptoms. The types of psychotic symptoms, I am quoting it from the standard book, which is the Fish Clinical Psychopathology. So psychotic symptoms are basically disturbances in thought, perception, and behavior, often leading to a loss of contact with reality. According to Fish, they can be divided into three parts. That is, one, disorders of perception. Then we have disorders of thinking, which includes your delusions and thought disorders. And third is disorders of self-awareness. Please be very attentive in these slides because these are your questions that are going to come. So coming to disorders of perception, these are hallucinations. Hallucinations are false sensory perceptions that occur without external stimulus. They are different from illusions, which are distorted perceptions of real stimuli. Mane, there is a person is hearing voices which are not audible to anyone else. That is an auditory hallucination. People feeling a crawling bug sensation on their hand, usually seen with cocaine drug abuse. इसको कहते हैं cocaine bugs. Okay, you can have visual hallucinations wherein you are able to visualize a man. It is always as if the man or the person is standing in front of you and they are so clear कि आपको लगेगा कि सच में एक इंसान खड़ा हुआ है. लोग जो पेशेंट्स होते हैं, they are actually seen talking to that person, pouring them tea, ऐसा कुछ, wherein you feel कि ये बात किससे कर रहे हैं. ठीक है. Then we also have gustatory perceptual abnormalities, having different tastes in mouth, having a metallic taste, yeah, having smell, bad smell. These are all disorders of perception. Coming to the auditory hallucinations, the most common auditory hallucinations observed in psychotic conditions are auditory hallucinations, hearing of voices. Seen in schizophrenia, they may hear voices talking to them, giving them commands that you should jump off the roof, you should currently do this, harm them, do this, do that. Discussing their actions. Two people are there and they will discuss this person, that, oh, look at this Radhe person. Now he's picking up the bottle, now he's pouring water from that bottle, now he's sitting on the chair, now he's getting up, now he's talking to this person. That is people when they're discussing their actions. Some individual experience a running commentary. जो मैंने बताया, that is also commentating hallucinations, where voices continuously comment on what they are doing. These hallucinations can be distressing. Obviously, someone constantly talking in their mind, it will be distressing and influence behavior, particularly if they involve commanding or threatening content. Sometimes these auditory hallucinations, they're usually very clear, like the patient is able to understand what they are saying, they are audible, able to hear it. They are coming from the outer source, as if someone is talking, standing beside them or standing there. That is coming from the outer objective source. They're never in their control. The person cannot control those voices. They will be there whether they want it or they don't want it. There might be a specific time during the day wherein they come. There might be a factor that they are coming when they are alone. कि जब कोई भी नहीं होता तब आपको आवाज आती है. Okay, they might even be very pleasurable. For example, if someone is hearing the voice of a god, it will be pleasurable. Sometimes if they're hearing voice of someone who is trying to harm them, it is going to be distressing. So ये सारे characteristics होते हैं आपके auditory hallucinations के, and auditory hallucinations schizophrenia में most common होती है. In general also, any type of hallucination, auditory hallucination is your most commonest type of hallucinations that you will experience. Coming to visual hallucinations, they involve seeing things that are not there. They may be simple or elementary visual hallucinations, which comprise of simple flashes of light or complex visions of people, animal, or objects. Visual hallucinations, they are more common in organic brain disorders, substance-induced psychosis, or delirium rather than primary psychotic illnesses like schizophrenia. However, visual hallucinations might also be present in schizophrenia. Tactile hallucinations, they involve false sensations on the skin. The classic example of tactile hallucination is formication, जो मैंने बताया था, bugs crawling under your skin, the sensation of insects crawling under the skin, commonly seen in cocaine or amphetamine intoxication, and withdrawal states like delirium tremens. Withdrawal states of alcohol is called as delirium tremens. Olfactory and gustatory hallucinations are less common and often associated with your temporal lobe epilepsy. Epilepsy is a seizure disorder wherein the focus is there in the temporal lobe of the brain. Or schizophrenia. Patient may experience strange smells like rotten flesh or poison, sometimes leading them to believe they are being poisoned. Somatic hallucinations. What are somatic hallucinations? These are abnormal bodily sensations. Patient may feel that their organs are being twisted, removed, burnt. These are very much common in again schizophrenia, and इस syndrome को बोलते हैं Cotard syndrome. Condition wherein the individuals believe that they don't exist and are dead. They are like walking zombies. They don't have any organs. Disorders of thought content. What is a delusion? This is one of the most important definition there in this slide. Delusion, first, they are false. That is not true. Firmed, very firm. Even if you're giving the contrary evidence कि नहीं ये बात तुम गलत बोल रहे हो, इसके हम proof दिखा देते हैं कि ये बात गलत है. Still they will believe it. Hence, it is firmly held belief that remains fixed despite the contrary evidence, and they are not influenced by the cultural background. These beliefs can often be bizarre and are not shared by others. Like me believing that I'm the most important person of this whole world and I'm an undercover agent, which I'm not, and people around me have the contrary evidence. I'm not an undercover cover. I'm a undercover agent जो इंडिया का सबसे ज्यादा इम्पोर्टेंट इंसान है और प्रधानमंत्री मेरे ऊपर नजर रखे बैठे हैं. और ऑल ऑफ दिस कम्स इन डिल्यूजन ऑफ ग्रैंडियोसिटी कि मेरे पास 4 करोड़ रुपए है मेरे बैंक अकाउंट में, तुम्हें नहीं पता पर मेरे पास है, and I can buy this whole world. This is again a delusion of grandiosity. We have delusion of persecution, believing that there is someone who is after my life, someone who is there, someone who is keeping an eye on me, someone who is recording everything that I'm saying, someone who is constantly trying to harm me. We had patients who actually installed cameras in their home, saying that my husband is cheating on me. They record everything, and after, when the people show them, see, you've recorded everything, and then there is no there. Their counter argument is that you have tampered whatever is being recorded. Hence, it is so strong. It's called delusion. ये जो मैंने आपको example दिया, that is delusion of infidelity, grandiose, and persecution. Coming to paranoid delusions. Paranoid delusions are particularly common in schizophrenia. Patients may believe they are being persecuted, followed, spied on. For example, someone may insist that the police or secret agents are monitoring their every move, even when there is no evidence to support this belief. Grandiose delusions involve an exaggerated sense of self-importance or power. A person with this type of delusion may claim to a prophet, a billionaire, or even an incarnation of a historical figure. These delusions are common in maniac episodes or bipolar disorder. People usually claim they are God in this kind of delusion. Erotomaniac delusions occur when a person falsely believes that someone, often a famous or a high status individual, mostly a celebrity, is in love with them. Like that person is head over heels in love with them. The patient may misinterpret minor actions such as a glance from a celebrity on televisions as a proof of affection. This is commonly called as delusional disorder, erotomania, or declarambult syndrome. Okay, now coming to somatic delusions. This is regarding your soma, and soma is our body. Patients may claim repeat sentence that their organs are rotting, their body is hollow, or parasites are infesting and flowing in their bloodstream. These are seen in schizophrenia and severe depressive psychosis. Nihilistic delusions, Cotard syndrome, सब कुछ खत्म हो रहा है, दुनिया खत्म हो चुकी है, मैं हूं ही नहीं. This is nihilism. Involves a belief that oneself, part of a body, or even the world has ceased to exist. दुनिया खत्म हो गई है, दुनिया खत्म हो जाएगी, खत्म ही है, अंत सामने है. This is your nihilistic delusion. A patient may insist that they are already dead and their intestines have vanished and the world has ended. This occurs in severe depressive psychosis and schizophrenia. Delusion of reference. Everyone in this world is talking about me and they're talking bad about me. Occurs when an individual believes that unrelated events or actions of others are directed specially at them. The patient may believe that a television presenter is sending them secret messages, or that strangers whispering in public are actually plotting against them. Random two people standing in the street and the patient is believing they must be plotting against me, they must be planning how to kill me. That is your delusion of reference. And therein the patient might go and act on it, like they might go and hit that person, that why are you plotting against me, just because they have this belief that they must be conspiring against me, and that person has never even seen those strangers. That is your delusion. Delusion of control. So basically delusion of control में the patient believes कि मैं ना किसी के कंट्रोल में हूँ, मुझे सब लोग कठपुतलियों की तरह चला रहे हैं, मैं जो भी करता हूँ वो किसी और के कहने पे कर रहा हूँ, मैं खुद अपना दिमाग ही नहीं है. ठीक है, so that is your delusion of control. They involve the belief that an external force is controlling one's thoughts, emotions, and movements. As in, the thought that is coming in my mind is not mine. It is some ex person's thought. The emotion that I'm feeling is also not mine. That person is making me feel that emotion. Every action that I'm doing is under his control. Even if I've hit you, it is not my own thought. He has made me do it. So that is your delusion of control. Patients may feel that their actions are not in their control but are being manipulated by a higher power. या तो aliens है या कोई government agency है. This is common in schizophrenia and first rank symptom of psychosis. Thought disorders. Now this comes to hamara thought. Thought. What is thought? Anything that thought is something that you're thinking. So every thought has a syntax. It has a structure. So when this thought structure, it has a flow, it has a content, and when this flow or this thought ka structure is dismantled, we call it something called as disorders of thought form. In psychosis, the thought process becomes disorganized and they're hard to follow. Like you won't be able to understand what the person is saying because you speak what you think, right? तो उससे आपको पता चल जाएगा कि thought ही गड़बड़ है. Loosening of association या derailment. That is, it occurs when thoughts shift from one idea to another in a completely unrelated way. The patient may start talking about their job and then they suddenly begin discussing an unrelated topic. This is space exploration without any logical connection. There are no connection between the two thoughts. It's very random, and it is very difficult for someone with a sound mind to follow what they are trying to say. कि एक टॉपिक इधर, ये टॉपिक इधर चल रहा है, तब तुम कहाँ का कहाँ पहुंच गए हो. So that is your loosening of association. Now coming to tangentiality. It refers to responding to a question in an indirect or irrelevant way instead of answering a simple question. Like where do you live? The patient may give a long, unrelated explanation about the history of their hometown without even stating their address. माने मैंने किसी से पूछा है तुम कहाँ रहते हो? So now, if this could be the answer, the patient is going to go here and here. कहीं पे भी जाएगा, but he is not going to answer my question. This is something we do in Vivas, but it's not pathological. But they will tell about that. They'll start, for example, they live in a certain sector in Delhi. They will not tell this that I'm living in sector 5 or 6 in Delhi, but I'll say that Delhi was the Mughals का empire था and everything, but he will not tell you कि exactly बात क्या है, वो क्या convey करना चाहते हैं. ठीक है, coming to flight of ideas. ये हमारा flight of ideas होता है, ठीक है. Flight of ideas, it is a rapid and continuous flow of thoughts with the speech moving so quickly from one topic to another, often in a way that is difficult to follow. It is particularly seen in mania. So this thought is connected to this thought. All the thoughts are connected, but they are jumping way too fast कि follow नहीं कर पा रहे हो आप. ठीक है, as in there is this, for example, tell me a sentence. कोई भी sentence बताओ. Sentence बोलो. So I am teaching psychiatry. Teaching psychiatry. तो फिर अब next thought जो हुआ वो teaching से हुआ. Teachers do teach. Teachers is also an alcohol brand. So people drink alcohol. Alcohol is bad for health. Like that. That might, and it's very rapid. Coming to word salad. So is one of the most severe forms of thought disorder wherein the speech becomes completely incoherent. The words are real, but they are strung together in a way that makes no sense. For example, a patient may say, sky blue, rain jumps, banana, elephant. कोई तुक है? कोई sense ही नहीं है इस बात का. This is called a word salad. Even how hard you try, you won't be able to make a sense of this word. This is seen in severe schizophrenia. Neologisms. Neologisms is new word. The person has himself created a new word. Neologisms are newly invented words that have no meanings to anyone except the patient. वो उनका खुद का discovered word है. That is called as neologism. The words may be entirely new or a distorted version of real words. For example, a patient may say that I feel very snoresified today. We don't know what this means. It could probably mean that he is very sleepy or he is having a lot of cold. For example, we can say that I am traveling in an air car. What's an air car? We don't know, but it's his word for aeroplane. That is called as neologism. Okay. Echolalia. Echo माने चीजों को repeat करना. It is the repetition of another person's word. If a doctor asks you, how are you today? The patient, instead of saying I'm fine, he is going to ask you, how are you today? How are you today? And how are you today? It's like the game, Chinese whisper. It is mostly seen in catatonia and autism spectrum disorders. Okay, it's called as echolalia. We have something called as echopraxia. Echopraxia is copying movements. Like if I'm standing in front of the patient and I'm doing this, he'll do this. I'm doing this, he'll do this. And I'm not giving any command to that doctor. I'm just randomly doing things. He'll start randomly copying me. That is called as echopraxia. Echolalia है जो बोल रहे हो, echopraxia है जो कर रहे हो. वो सेम रिपीट हो रहा है तो उसको इकोलेलिया एंड इकोप्रैक्सिया बोलते हैं. इट्स वेरी वेरी कॉमन इन कैटाटोनिया एंड ऑटिज्म स्पेक्ट्रम डिसऑर्डर्स. ओके, सो डिसऑर्डर्स ऑफ इम्पेयर्ड इनसाइट. इनसाइट होता क्या है? टू बी एबल टू बी अवेयर ऑफ द इलनेस दैट यू आर हैविंग. So in psychotic disorders, insight is often impaired. They don't believe they have a disorder, meaning that the patients are unaware of illness. They have three there are 3 levels of insight. Complete insight, that the patient understands that the symptoms are a part of a mental illness. Okay. Partial insight, the patient recognizes something is wrong but believes that the problem is external. I know I'm hearing voices, but it is because my family members have done black magic on me. That is partial insight. He knows that there is a symptom present, but they're attributing it to a physical factor. Complete illness, I know I'm hearing voices, and it is because I have a problem in the neurotransmitters of my brain, or I know that it is a part of mental illness. This is your complete insight. Now, absence of insight is, I'm perfectly fine. I don't hear any voices. And even if I'm hearing voices, it is present with everyone. Everyone hear voices. I don't have a problem. So if the person is not even realizing that they have a problem, why will they seek treatment? Treatment ही नहीं लेंगे. So वो कभी ठीक ही नहीं होंगे. इसलिए lack of insight or having no insight, it's a key factor in treatment resistance. ठीक है? As individuals who do not recognize they have a disorder are unlikely to seek or adhere to treatment. Coming to additional thought phenomena, passivity phenomena and thought disorders. Thought insertion क्या होता है? Wherein they believe that thoughts are being inserted into their mind. The thought is not mine. That is called as thought insertion. Thought withdrawal. हैरी पॉटर देखी है? उसमें एक होता है ना कि थॉट निकाला है किसी ने, थॉट या मेमोरी निकाल करके वो उसमें दिखाते हैं. सो दैट इज थॉट विड्रॉल. मेरे दिमाग में जो विचार था वो किसी ने बाहर निकाल लिया. दैट यू कॉल्ड एज thought withdrawal. Thought withdrawal is a belief that one's thoughts are being removed or stolen. A patient may insist that my mind was full of ideas, but aliens took them away, or aliens are implanting thoughts in my mind. Thought broadcasting. Everyone around me knows what I'm thinking, or whatever I'm thinking is getting printed on media. ठीक है, लाइक ऐसे ये टेलीविजन है, नीचे न्यूज चलती है, तो उनको लगता है कि जो नीचे न्यूज चल रही है वो मेरा खुद का विचार है जो चल रहा है. ठीक है. पैसिविटी फिनोमेना रेफर्स टू being of experience of being controlled by external force. A person may feel that their movements, emotions or even speech are directed by another being. This is again aliens मुझे चला रहे हैं. Schizophrenia. Catatonia, it is severe motor disturbances wherein the patient may remain motionless for long hours. They can stand in the sun for 6 to 7 hours without feeling affected. If they are sitting, they might sit for 4 days straight. That's called catatonia. Okay, they may also show bizarre postures. In some cases, catatonia involves excessive purposeless movements as well. Okay, ये बहुत important difference है. मतलब मुझे लगता है सब कुछ important है, but still. Psychosis and neurosis. सबसे पहला, you need to know the definition. Psychosis, severe mental disorder characterized by loss of contact with reality, including hallucination, delusions, thought disturbances. जो हमने सारे fish के criteria पढ़े हैं. Then neurosis, it's a milder psychological condition where reality testing remains intact, but the person is experiencing distressing emotions. ठीक है. And maladaptive behaviors, contact with reality lost, contact with reality maintained. Insight into the illness often absent, usually present. Severity, more severe. Psychosis ज़्यादा severe है या neurosis ज़्यादा severe है? Psychosis is more severe. Symptoms, psychosis में hallucination, delusion, thought disorders, disorganized behavior, catatonia. इसमें क्या हो गया? Anxiety, depression, somatic complaints. Cognitive impairment, more in psychosis, less in neurosis. Thinking is clearer in psychosis. Hallucination, delusions, more in psychosis, not in neurosis. Thought disorders psychosis में मिलते हैं, neurosis में नहीं मिलते हैं. Mood swings दोनों में होते हैं, but more extreme in psychosis. Behavior more bizarre and very inappropriate in psychosis. Controlled and may be affected by anxiety in neurosis. Social functioning impaired, very severely impaired psychosis, mild to moderately impaired in neurosis. Types of disorders, सारे schizophrenia के disorders, schizophrenia, schizoaffective delusion, mania with psychotic features, severe depression with psychotic features. इधर आ जाएगा anxiety, OCD, PTSD, everything. Onset acute, insidious, usually gradual होता है neurotic में. Causes similar है. Response to treatment, for psychosis we give antipsychotics, for neurosis we give CBT, lifestyle changes, antidepressants, anxiolytics. Prognosis, for neurosis it's good prognosis, but psychosis the prognosis varies. It depends upon your compliance to treatment, and also there might be certain conditions which require lifelong medications. ओके, ट्रीटमेंट आ रहे हैं, ये बता रहे हैं हम. ट्रीटमेंट थोड़ा सा ही बताएगा. ट्रीटमेंट है एंटीसाइकोटिक मेडिकेशन फॉर साइकोसिस. इट्स एंटीसाइकोटिक मेडिकेशंस. फर्स्ट जनरेशन एंटी, आई नो थोड़ा सा अच्छा है. फर्स्ट जनरेशन एंटीसाइकोटिक्स haloperidol, chlorpromazine. We have second generation antipsychotic. First generation के बाद second generation क्यों आई? To reduce the side effects which were caused by the first generation. So second generation antipsychotics are risperidone, olanzapine, clozapine. They have fewer motor side effects, but the risk of weight gain and metabolic syndrome increases. Then we have psychotherapy. There is a different kind of CBT for psychosis, which is called as CBTP. And hospitalization is needed, supportive care, psychoeducation of family members. Now, what is schizophrenia? I have explained everything that is there in schizophrenia, which is mostly all the features of psychosis. But let's come to the criteria, like how will you diagnose that a person is having schizophrenia. In India, we follow a international classification of disease system, which is called as ICD. Currently the one that we are following, it's called as ICD-10. We have another one, ICD-11, which is going to be published, or I think it's published now. Firstly, the most important is duration. जितने भी symptoms हैं, they have to be present for at least a minimum duration of 1 month. You have A to D major criteria होते हैं. Criteria number 1 is thought echo, thought insertion, thought withdrawal, thought broadcasting. इनमें से कोई होना चाहिए for a duration of a month. या delusion of control, influence, passivity, clearly referred to body or limb movements or specific thoughts, action, sensation, delusion, perception. Aliens वाली बात ये हो सकती है 1 महीने तक. Hallucinatory voices which might be giving a running commentary on the patient's behavior, discussing the patient among themselves, or other type of hallucinatory voices coming from some part of the body. Yeah, persistent delusion of any kind that is culturally inappropriate and completely impossible. Example, being able to control the weather or being in communication with aliens. If any of the 4 is present for 1 month, good enough to make the diagnosis of schizophrenia. ठीक है? Major symptoms में any one, you can make the patient has schizophrenia or the patient has schizophrenia, or any 2 of these 1, 2, 3, 4, or any 2 of these 4 minor criteria. Criteria number E is persistent hallucinations in any modality when occurring for at least 1 month, when accompanied by delusions which may be fleeting or half-formed without clear effective content, or when accompanied by persistent overvalued ideas. I know it's a little tough, वो समझा देंगे बाद में. F is neologisms, break or interpolations in the train of thought, like derailment, loosening of associations, incoherence or irrelevant speech. G is catatonic behavior. Catatonia can be of 2 types: catatonic retardation, catatonic excitement. Both catatonia comes here. Catatonic behavior as an excitement, posturing, waxy flexibility, negativism, mutism, stupor. You guys will probably might have another class on catatonia wherein all of this will be discussed. And we have negative symptoms such as apathy, paucity of speech, blunting. Blunting क्या होता है? Mask like face. No matter what you say them, their expression is going to be like a mask. So that's called as blunting. Incongruency of emotional responses, and again the duration has to be a month. So 4 major criteria में से कोई भी एक, या 4 minor criteria में से कोई भी दो, to be present for a duration of 1 month, you can make the diagnosis of schizophrenia. Schizophrenia में 3 type के symptoms होते हैं: positive, negative and cognitive. Positive is hallucination, delusions and disorganized speech. Negative is blunted affect, anhedonia. Anhedonia is not having the motivation to do anything. Alogia is speech. Alogia affects your sleep. Sorry, anhedonia is your loss of interest. Avolition is avolition, as in no motivation is avolition. and social withdrawal. Patient is remaining to himself. We have cognitive like memory impairments, attention deficits and executive function deficits. ये मैंने एक we've put a picture wherein there is hallucination. There is delusion that I am delusion of grandiosity and disorganized speech and thought. Negative symptoms, anhedonia, to do, avolition, doesn't want to do anything. And blunted effect, mask-like face. Memory issues, unable to process social cues and impaired sensory perception. Last topic, ICD-10 की classification से. अभी ये तुम्हारे I think seniors के नहीं, इस your course पे ये पूरा question था. As it is they gave a question on classification of psychiatric disorders. So F00 से F98 coding होता है classification of disorders का. F00 to 09 they include organic mental disorders. 10 से 19 हमारे substance use disorders होते हैं. 20 to 29 you have schizophrenia and psychotic disorders. 30 to 39 we include mood disorders. 40 to 48 is anxiety spectrum. 50 to 59 eating, sleep and sexual disorders. 60 to 69 personality behavioral disorders. 70 to 79 intellectual disabilities. 80 to 89 neurodevelopmental disorders and 90 to 98 childhood and adolescent disorders. Disorders, dekho, you will be knowing which patient to be referred to a psychiatrist. We deal with all of these things. ठीक है. Coming to F00 to F09. थोड़ा सा पक्का. चलिए जल्दी I'll do. Organic, including symptomatic mental disorders. 00 is dementia in Alzheimer's disease, vascular dementia, dementia and other causes. Unspecified dementia, organic amnestic syndrome, delirium which is not induced by alcohol or drugs, other mental disorders due to brain damage and personality and behavioral disorders due to brain or disease. 10 से 19 हमारे substances हो गए. 10 is alcohol, 11 opioid, 12 cannabinoids, 13 sedative, hypnotics, anxiolytics, 14 cocaine, 15 stimulants like amphetamines and methamphetamine. 16 is hallucinogens like NSD and psilocybin. 17 is tobacco, 18 is inhalant, and 19 is multiple substance use disorders. Complete करने दो. 20 schizophrenia, 21 schizotypal, 22 persistent delusional disorder, 23 ATPD, 24 IDD, that is induced delusional disorders and schizoaffective disorders. 30 is mania, 31 is bipolar affective disorders, 32 depressive disorder, 33 recurrent depressive disorders, 34 persistent mood disorders. F40 में आ गए phobic anxiety disorders, 41 other anxiety disorders, 42 OCD, 43 reaction to severe stress and adjustment disorders includes acute stress reaction. 44 is dissociative conversion, 45 is somatoform disorders. 50 में eating disorders includes anorexia nervosa, bulimia nervosa, binge eating disorders. 51 sleep disorders not due to substance. 52 is sexual disorders not due to any organic cause. 60 specific personality disorders, that is includes borderline, antisocial, narcissistic, avoidant, dependent personality disorders. 63 is impulse control disorders, includes gambling, kleptomania, pyromania. Kleptomania, liking stealing things, and pyromania, liking setting things on fire. ठीक है. 70 is mild intellectual disability, moderate 71 moderate, 72 severe, 73 profound intellectual disability. 80 में आते हैं आपके language learning and social skills. 80 is language disorders. 81 is learning disabilities, जैसे dyslexia and dyscalculia. 84 is pervasive developmental disorders, autism spectrum and Asperger's syndrome, तारे ज़मीं पर वाला. ठीक है. 90 is hyperkinetic disorders, that जैसे ADHD. 91 is conduct disorders. 93 is emotional disorders of childhood, जैसे separation disorders, social anxiety disorders. Thank you so much guys for listening.